This 86-year-old patient went skiing with boots that were too tight and unfortunately developed frostbite on the first 4 toes of his left foot. The initial pictures were taken after he had tried every remedy available over a 6-month period, even including using a hyperbaric chamber to try to get the circulation going and get some oxygen down to those toes. After 6 months without success, the decision was made to amputate all 4 toes. Of course, he was very reluctant to have the amputation, as that would have affected his ability to walk normally. He came in for laser treatment. The pictures on the right show that after just 5 days of consecutive laser treatments, those toes have pinked up and are restored to normal healthy tissue. He was gratefully able to keep his toes. Berger's disease is caused by smoking. Like diabetes, smoking can affect the small capillaries, particularly in the hands and feet, resulting in this inflammation of the tissues. If the patient gets an infection, it's very slow to heal. Berger's disease is an extremely painful condition and often results in amputation. Laser therapy increases circulation through the formation of new blood vessels, and this individual's toe and foot have returned to their normal, healthy pink color after 12 treatments over 3 weeks. We of course advised this gentleman to stop smoking, but despite having gone through this medical crisis, his response was, "Why should I ever quit smoking now? I know if I ever get into trouble again, I can just come in for more laser treatments." Unfortunately, smoking is a very strong addiction. This gentleman is suffering with ulcers due to diabetic neuropathy. Again, the loss of sensation and circulation in the hands and feet. Even a simple little blister or a cut on a diabetic's foot can develop into these necrotizing ulcers that are extremely difficult to heal due to poor circulation. You can see from the pictures on the left that this gentleman already has lost his baby toe to a previous diabetic ulcer which would not heal and required amputation. This time he has a number of ulcers, in particular a rather large crater-like ulcer on his heel. Once again, all these pictures of diabetic wounds were taken after the patients had gone through 3 to 6 months of traditional wound care, which involves a public health nurse coming daily to your house to change dressings, clean and debride the wound, and apply antibiotic ointments. This patient was given 10 laser therapy treatments over 2 weeks, and you see from the pictures on the right that that ulcer is no longer infected and has considerably reduced in size, almost completely filled in with a small scab in the center. So again, we were able to save a foot from amputation. Here again we see another diabetic wound on a big toe which was not healing. After 10 treatments over just 3 weeks, the patient is fully healed and is able to go back to his normal activities. Here we have more diabetic ulcers, and this gentleman, you can see from the pictures on the left side of the screen, had large gangrenous lesions. This patient had already lost the big toe on his right foot and the 4th toe on his left foot from previous diabetic ulcers, and he was now facing a bilateral amputation of both feet. He also came in for laser therapy, and in the pictures on the right side, you see that after just 6 one-hour treatments, there are only scabs remaining, and both feet are well on the way to complete healing of the ulcers. This gentleman was very happy not to have to undergo a bilateral amputation. This is a picture of a gentleman suffering from large weeping ulcers caused by thrombophlebitis. Again, this is a problem of poor circulation, and these are extremely painful lesions, very slow to heal. Thrombophlebitis can sometimes go on for months without resolving. You can appreciate that with large weeping ulcers like this gentleman has, it would be very difficult for you to dress or go about your normal activities. Here are pictures showing the progress of healing. After 8 treatments, the ulcers are able to scab up, closing the open wounds. Later, after 23 treatments, the ulcers are almost fully healed with new pink skin. This gentleman had had his foot run over by a car 35 years previously, and in the first picture on the left you'll see that his 3rd toe is purple and bruised. So for 35 years he'd been suffering with pain and inflammation in that 3rd toe. Every step was agonizing. When he came to us, we weren't sure we could help him, but after 23 treatments, that toe was completely restored to normal. No longer any bruising, no longer any inflammation, no longer any pain. A happy individual. This again is another diabetic wound, and you can see the enormous lesion in the left picture. Again, this was after 6 months of traditional wound care, and because the tissues had failed to respond, he was also facing amputation of the foot. But after just 21 treatments over 9 weeks, this gentleman's foot has completely healed up, and he was also able to save his foot from amputation. So there's a huge application for this therapy in treating diabetic wounds and ulcers. This patient has chronic lymphedema. Lymphedema is the collection of lymph into the tissues. Extremely painful, and uncomfortable swelling usually occurs in the legs but can also occur in the arms. After only 10 treatments, we see a complete reduction in the swelling, and the pain is gone. Here we have another picture of chronic lymphedema, and after just 9 treatments, we were able to reduce the diameter of this woman's calf by 6 centimeters. This young gentleman, 20 years old, has suffered a brachial plexus tear. In these initial pictures, he's unable to lift his right arm or to turn his neck. He had torn all the muscles and the nerve plexus on the side of his neck. These intermediate pictures show that after just a couple of weeks of treatment, the young man is able to turn his head from side to side. And at the end of his treatment, after just 2 months, he's able to raise his arms fully. He has full range of motion in his neck, and this very serious injury has been healed in a short course of time. Here we have a bursitis affecting the bursae just over this gentleman's elbow. A bursae is a fluid-filled sac that lies in between a tendon and a bone and allows ease of movement, reducing friction as we move our arm up and down. You can see the large goose egg swelling resulting from this inflammation. Bursitis is very painful, and many people find it makes sleeping almost impossible. But here we see, after 6 treatments over just 2 weeks, the elbow is completely healed, no longer swollen, no longer painful. As you have seen, the proven results of laser therapy are nothing short of amazing, providing quick and effective healing even in cases where healing was previously impossible. These profiles represent some, but not all, of the conditions that are treatable with laser therapy. The treatments are painless, and after millions of applications, have produced no side effects of any kind. We're proud of what we do here at Tri-City Laser Light Therapy Clinic and hope that we will be able to help you or your friend or loved one to live a better quality of life. Thank you for viewing our presentation.